Okay. Chinmay sir, going ahead. We'll see what is descriptive. If I say the impression tray you chose is small.
ये मुझे
Ma'am,
करना है.
there is a echo, ma'am.
हाँ,
Can you
इसमें से मैंने 2
log
कर
out
लिए.
and
My
log in
side.
again?
It is
मतलब एक
because they are recording, I think.
Okay.
Will not.
Anand
Now
Patil?
echo will not come. Is it coming still?
No.
Okay.
Okay. So it has to be just descriptive of the task. We will have many examples. Then it has to be specific and not general. And if you would have, Chinmay would have asked her, how does Nagda madam look with a tied hair? She would have said, I like her more. I like her, but I like her more with open hair. Something like that. This is general example. You give only prosthetics. Focus on changeable behavior. What can be changed? And emphasize on the consequences and timely. Can anybody, Mirna, I can see you. Can you go through the slide and describe what I mean?
A descriptive and not judgmental means you have to give a genuine opinion, not a biased one. And
And no,
specific.
don't be judgmental. Just because a student is not very much liked by you, you may give a not a very correct description, or your student is your favorite,
Mhm.
and again you will praise the student. So
Yes.
let it be just descriptive.
Mhm.
The tooth arrangement is aligned well, but in the patient's mouth during the trial, we feel that it gives a very artificial appearance because every tooth is aligned in a line. For a 80-year-old or a 70-year-old, whatever you can say, that is descriptive. And it was specific, and then you can focus the change.
You have to be a very pinpoint regarding which character you are testing or which character you are going to give the feedback. Like Chinmay sir asked regarding your beauty, we have to specify you to your beauty only. We cannot go to other features. Okay, even if we like a student, but that student is not done the procedure correctly, we can't say that you have done good. To improve his clinical skill, we have to be specific that you have done wrong in this thing and give the proper advice.
And you can give him, suppose the tray is short in the mylohyoid region, you can say extend the tray, the change in the behavior can come. You are definitely telling him the consequence that you will capture the lingual region properly. So you are giving it timely so that he can correct, next time he takes an impression well. And it has to be on first hand impression of what you have taken, what you have seen, not because ex staff member came and told Mirna that student is not good and you give a feedback. What do you mean first hand? You cannot provide feedback on skills you have not observed or knowledge you have not questioned. You have questioned him, he has not answered. You can say, yes, you need to reinforce on this area. You can say reasoning you have not heard, you are not given the opportunity, and attitudes you have not experienced. If I tell Mirna that Jyoti has an attitude and she thinks no end of herself, you cannot make an opinion out of that. You have to experience it yourself regarding Jyoti. Jyoti, you are good, huh? I just give an example. Jyoti is there? Jyoti? Jyoti? Jyoti disappeared, I think.
कोई बात नहीं तो अच्छा है आप now she has not listened you.
Is the internet problem for her or where is she? Okay. So now let's come into how to give a feedback. Describe the performance, the task. Don't immediately give everything out. Wait for the learner's comment. The learner may provide you insight into the problem. So he will say, if you say that the impression is not manipulated properly, he'll say, Madam, today being a very hot day, it was warm water, I will try it again. Recommend how to improve. Coach and not judge. Don't be a judge. You're always bad. Or you repeat. Repeat has got no meaning. You took way too long for interviewing that patient. You need to be out of the room in 20 minutes. When the history taking, the student took a long time. You could easily say, I noticed you were in the patient's examination room for almost an hour. Then if you wait, the student may reply, I know, I just could not get the patient to stop talking. I did not know which questions were most important to ask. I spent 40 minutes during the physical examination. Now you can recommend how to improve. Are you with me, all of you? Now,
Yes.
instead of saying repeat the impression, it's wrong. You can say tray is to be centered. Centering the tray captures both sides balanced way. First of all, check the tray size. Centralize it. Now, if the tray is very short in the buccal area, you need to capture it. So extend the tray if needed. What are the tray extension materials you can use? You can ask. There is a pulling of the impression because the student has probably dragged or tried to take out the impression before the final setting. You can tell him that. And you can say the manipulation of the material was not balanced even. I can see some streaks of the other color, the catalytic agent in the rubber base, or you can say that the alginate is too gritty. It is not manipulated well. Then you wait. If you wait, the student can reply to you, should I take a bigger tray? How the alginate set too fast, how to do it? Or he can ask you multiple questions. So somebody is doing a project on environment, academic environment, safe. Is all not this important? Isn't it? Recommend how to improve. Read the recommendations for using the material. You can find them. How the material is used, please read. Go and read the book, no. You can see there are recommendations in the particular chapter, or there is a handout in the department. We must keep an handout for the students for manipulation. And in your private practice, if the material is ordered too close to the expiry date, you can say that it is very difficult whenever you depend completely on computer. You have to pay attention before ordering. And if the student says, Madam, this is the way I was shown in the demonstration, the border molding. Okay, I will clarify with the Dr. Anand Kumar. I will clarify with him. You cannot say, Anand Kumar has shown you. That's wrong. You cannot say that. Okay? We should not say that.
Yes.
Disorganized student presentation. He's presenting to you more in the class or in the morning a case, and you need to improve your presentation. It's not specific. Like she said that I'm looking very good. That's not specific. What is good? Is the way I have tied my hair, or I have done something else. We don't do anything. I have just sitting from 2 o'clock to prepare your presentation. So I have not even gone to change or do anything. That doesn't matter online, isn't it? Whether how. So you can say this morning on rounds, your presentation was disorganized. It was very specific, disorganized. It is difficult to follow your thought process, dear. You are difficult to follow your thought process. Wait for some time. Student can tell you what the problem was from their standpoint. It can be recommend how to improve. When you have a complicated patient, organize your presentation with a problem list. He has comorbidities. He has got interventions done earlier, certain surgeries done, and now he has got acute condition, and now there are multiple teeth missing, and he has a history of collecting and repeatedly going from one clinic to other because he's not satisfied. So what do you want to say? That way others can follow your thought process regarding the case. Also, you say on rounds, listen to how the first MDS or interns present the case. If at all you are allowing them to present, try to model your presentation like that. The senior, what I mean to say is, see, peer learning, I told you, peer learning is the best learning. With the group, you will learn the best. So, what are the barriers to feedback? We have a feeling that the students have been told and still they are not following. They know what they are doing. They know they are doing wrong. Maybe it is just an anomaly. It is not a regular habit. You observe it. That is why we need to have a checklist. All these things are not extra tasks. Huh? I will show you how you can make it regularly in your college, in your clinic, and how you can tell others also how to do it. Sometimes we feel awkward to give a feedback because that student is influential, or maybe he's not able to take it. She always cries. And then some teachers say, I don't have the time to give feedback. All these things are extra work. I don't have the burden. Already I am being paid some 70,000 for that. I'm doing 8 hours of work. I can't still increase my hours. So it all depends how the psychology, how you're taking it. Let's see the different models of feedback. Chinmay, you want to take it over?
Madam, no problem. Continue, madam. No problem.
So there are many models. There are many models of feedback. One is the sandwich model. Okay. Sandwich has got, I will not say all these nonsense examples. I will only say sandwich has got your butter, your some dressing like chutney. You can have vegetables, and you can have a piece of cheese also. So it is being called as behavior, example, effect, and future. You can give a feedback on behavior. Maybe his attitude towards the patient while giving the instructions needs to be little improvised. He must be empathetic. You give an example how to do it, what effect it will have on patient when you give a good nutritional counseling and follow it up, and what about the future. So there is a lot of importance that you give to the technique, because feedback techniques, the old sandwich and the new sandwich, both we will discuss. You can bridge it. An evidence effect change technique. What is the, you have the evidence that the impressions made or the arrangement or the denture centric relation is not right. So you can just have the evidence in front of you. It will have an effect on the temporomandibular joint. Patient will not be able to chew. So what changes he should do? Should he do a rebasing or relining or completely change? Then there is Pendleton model, which we'll discuss. And there is set go model, which we'll discuss. There is Aloba, which is used in the Pendleton model. All these things are named, and in 5 minutes you will get everything. So don't get intimidated. There is a boost model, wherein you boost the morale of the student. Feedback grid model for written feedback by walls. There are many models of feedback. Okay, I'll discuss 2 or 3 of them. The old feedback model is, first you say, well done, well done. I think your trial for the first impression is good. But now what I find is you have not positioned the tray well, and the impression on one side you have given more pressure than on the other side. And then again you say, I think you will do better the next time. So please repeat the impression with these things in mind of centralizing the tray and also giving equalization of pressure on both the sides. So it becomes very palatable. It becomes, student can take it. Now what we do is we have a modified model. You ask the student what is your thinking or not opinion, what do you think about the impression that you're showing me? What is this answer that you are given, long answer? Can you give me some feedback? How do you think it can be written and how have you written? Then you tell the student that whenever a question is asked for 10 marks, I think you should have clear thought and make it into 3 or 4 paragraphs. You can give the definition, you can give the various methods in the second paragraph and describe 1 or 2 methods, and you have been told to actually compare the methods, so you can compare. So you first ask, how did you do? The student answers, you tell him what to do, then again ask him as to now what, how will he go ahead? Okay, adaptation of the new feedback sandwich, common in patient physician communication literature. Okay, it's used widely in medical education. In asking learner to self reflect, give him some time, don't be quick, come on, answer. Or we are all hard pressed for time. I have all done that also. It's not that I'm separate and I've always been like this. Give the time, learner time, so that he gets the time, and encourage him. Yes, if even if you say 1 or 2 words, it's enough. Some of them don't answer. They have been told by the seniors, "Muh nahi kholna, muh khole." If you open the mouth, you will get into trouble. So you say, "I don't know, I don't know," or yes, madam," like that. Okay. When you tell what you observed, whether the diagnosis regarding the bony spicules or maybe the diabetic patient having injury from the denture, you explain specific observed behavior, that he did not observe the bony spicule and made the impressions or was going to make the impression. Now react to the learner's observation. Self-assessment, we are going to talk next, is very, very important. Include both positive and corrective elements and give reasons in the context of well-defined shared goals. What is your shared goal? The patient should get a good prosthesis. That is the shared goal, right? Yeah. Again, ask about whether he understood. Can you explain just now? How are you going to go ahead? Am I clear? Should I explain again? What could you do differently now? Perhaps even replay parts of the encounter, what you have told him. Commit to monitoring improvement together. I'm sure if you follow this instruction, it will be, the impressions will be good, or maybe whatever your answer will be better, and I will be able to help you again. So together. Now, Pendleton model. Check the learner wants and is ready for feedback. This is the readiness scale. Everywhere you will see in education readiness scale. Self-directed learning, I told you about readiness. If the student is ready only, then he will learn on his own. So check the learner wants and is ready for the feedback. There are questions we will see, we can ask. Would you like my comment on the correlation, what you have done? Do you want to, you're placing the tracer, should I tell you? So you are preparing his mind. Let the learner give comments regarding the background to the material that is being assessed. Let him give first. The learner states what was done well. So what is done well, he states. The observer states what was done well. First, the learner states that the vertical relation is, so far the patient's speech concerned and the looks concerned, lip closure is aesthetic enough, and it's right. We feel for the present time it's right. So you are both saying it is okay. The learner states what could be improved, and now the observer says how it could be improved. Both of them can have an action plan for improvement. Don't think this will take a long time. Every day in the morning when you get up, you have certain course to perform. Automatically it becomes embedded, it becomes habitual. Same way in your teaching, I will make it, help you to make it habitual. This is very simple. And when you say aloba, what Pendleton uses is there is an agenda led outcome based learning. So what Mirna I think said is we should be focused on the task and not giving some other example. Very right. So it's agenda led outcome based analysis. There are some rules for Pendleton. Self assessment by learners should be encouraged and done well. Okay? Then, what was done well reinforced by the facilitator group? You remember I told you, you are not a teacher, you're a facilitator, you facilitate learning. The first class, second class when I took. You remember? I want a feedback.
Yes, madam.
Skills used to achieve successful outcome discussed. How the skills can be made better? If the student has missed out on the medical history and not able to record certain things, the patients do not come out and say 10 साल के पहले मुझे admit करना पड़ा. One patient did not say that he had a stroke, and when the extraction was being done, patient went into syncope, and there were a lot of problem rising the BP. Colleges have everything to tackle, private clinics don't have. So this happened in a private clinic. The patient had to be rushed to a 5-star nearby hospital. Then the fight started, who will pay the bill? The patient said, it happened in your clinic, you pay. So in order to avoid many things, it is the right situation to prepare the students right in our institutions by strengthening learning through feedback. Self-assessment by learners is extremely important. Can you comment on the work done by you about the jaw relation, centric relation? How did you do the vertical relation? Which method you followed? What are the things? There in the conference, they were saying used, that fellow was from Russia, and he practices in Dubai, I think. He was telling, or maybe I am talking about a Korean, I forgot. Emma, Emma, Emma. We asked the patient to say Ma, no? We asked him to say Mississippi. He said, say Emma. So Emma line they say. So it depends, it's country specific. It's whatever you can use. You ask him what can be done better and what is it required? How can you help him to improve the skills? The facilitator suggests alternative skills if necessary. If in a poor foundation case, just excuse me for a minute, and I want all of you to discuss your experience. And the first slide I showed you could not tell me. So please go back and think about it. Hello? How was it? Jet lag has gone. Okay, I'm back again. Are you all there?
Yes,
Yes,
madam.
ma'am.
Yeah.
Yes,
Sorry
ma'am.
for the interruption. My son called from USA. He reached yesterday. or day before. So he just called because, okay. And so the facilitator can suggest alternative methods. For a poor foundation case, I was telling you, many a times the impression materials used, the technique has to be slightly tweeted so that they get the better result. So all these things we can help the students. So learner feedback to facilitator, content of the feedback, and see the learner feedback to facilitator, whether he understood everything well or he needs to give it better way. There is no time for us in the dental colleges if we follow all these things and on the task. Have you seen anybody in the other profession able to spend a lot of time together, all workers in a table around the chairs and talking of non professional things, and even going to the extent sometimes on personal comment on a learner? This thing is not possible anywhere in the world. Of course, the 23 things are changing, and it's changing for the good. The present generation is much better. We are not bothered about, I always belong to the future generation. Huh? I was never bothered about who is wearing what and who is going with whom and all those things. That's all personal things, right? But the young learner at the age of 18, 19, 20, his emotional intelligence level is not as good as ours. He feels very bad and he feels a low esteem. That's the biggest crime. So most of the institutions abroad take a learner feedback on Meenakshi. Learners, teachers give, the students give feedback on Dr. Nagda. So when they give the feedback in the Middle East universities, I will make Dr. Avinashi speak to you. In Saudi Arabia, if the feedback from the learners is not up to the mark, you are not given the extension next year. To that extent, education is important. So what happens is, it's a regularly done phenomena for them. And last year he joined the course, and it helped him so much that he got the best teacher. What you say, best teacher, there they say something else. That award he got because he could apply many things. He applied team-based learning there. See, what I mean to say is, lots of courses are done by universities, by your state level, national level. Lot of things you hear and you go. You hear, you are happy. You are happy, you feel you have learned. It's only a pseudo feeling. But unless you apply, you have not retained in the long-term memory. Okay? So will you all promise that you will apply? Okay. The set-go model. I saw specific and descriptive. I saw this. I saw your primary impression trace. You had heated the compound to a very high temperature. Very few people may be using compound today, but compound is still a very good primary impression material. And what else did you see? You tell him that the material loading was wrong. The material loading needs to be even both sides. And what did you think? What did you think? You ask the learner and you also tell him what did you think about the specific task? What goal we would like to achieve together? The students' dentures are repeated. You say all the students are doing the dentures and they are all to be repeated. That's because you are not giving supervising properly. Offers of how we could achieve this. So you are offering to help. Learning without feedback is learning archery in a dark room. Ekalavya learned with Dronacharya's statue, but he had bright light in the open that he could see. Learning without feedback, the students are learning. They feel I'm correct, they're doing wrong, I'm correct. Everybody is happy. At the end of the term, the university gets 100% result. It's not, we are not achieving great things. The important thing to remember about feedback in medical education or dental education, it is necessary, it is valuable, and it has to be practiced regularly. Plan different ways of giving feedback, and it is not difficult as you might think. Okay, so I will stop the presentation and I want some questions and I want your experiences. Can have all videos on. Jyoti? Jyoti? Jyoti is still missing, man. Jyoti?
Yes, yes, ma'am.
You did not, you were not in the present in the session, man. What happened? What is the problem?
Actually, at my home, they asked me something, so I was supposed to give them very urgent.
But that's you will miss.
But I was listening to all your
But I was calling you, Jyoti. I was calling you constantly.
Yes.
Okay, Siddharth is there or Siddharth is traveling?
There, madam.
Yeah, okay. Okay. So now, can you come back? Now that you have attended this session, do you realize how important feedback is? And the feedback to be given constructively, feedback should be given immediately. It is important for student learning. It is very, very important for their progress. Same way with us. Now give me a feedback of this session. Be very descriptive, specific, constructive, and you can say anything. Because many a times feedback given not good, I become emotional. I become, अरे ऐसे ही मेरे को बोलते मैं इतना मेहनत किया. That's not the question. I told you about my incidents of singing. My sister gave me a good feedback, but the way she put it, that doesn't mean she's wrong. What is the meaning behind the teacher? What is the thought behind the teacher telling a student something? Students don't see. Students only see how you say it. Students do not care how much you know and how much you taught. They only care how you handled them, how you spoke to them. Spoke to them. And this all we don't realize. We think we care for them, and you were told the postgraduate students, if you don't do this, then I'm telling you, you will be punished. The student only remembers punishment ka word. He did not remember that madam had a good thought and that's why she said. Okay, now from you. Give me some rest, man. I have to take one more session.
Madam, regarding feedback you talked about, is there any specific situations where specific feedback is useful, or it is just that people have given different ways of feedback?
Dear sir, your voice is not clear.
Okay. No, madam gave us different types. Even I cannot recollect the exact. One was something like
Sandwich.
See, one is sandwich, second is Pendleton feedback.
Okay.
You can use any.
Let me ask you one question. That what are the different situations you all feel where you can give the feedback?
One is obviously observing a student doing procedure or a practical procedure.
Okay.
Maybe share your experience with them, what went wrong and how you could rectify, because those situations you would have also handled.
Okay.
Give your own experience about the procedure.
Little bit. See, if we give the same example of what I've asked madam to Sandhya madam to give the feedback to the madam, and madam has shared one wonderful slide in between that what are the important steps of the feedback. So if I will give on that way, so let me try. Hello ma'am. So It seems that you are very happy today and looking nice. Your bindi is also very good. And it doesn't seem that with your clothes and your appearance that you are tired and you are busy with your home. But I would like to have one suggestion, ma'am, that whatever you are looking nice, rather than having this gown, if you wear a sari during online class or with the blazers, it would have given a stunning appearance for you. And
It's
it will
not a
give
gown, it's a
icing on the
salwar
cake too,
kameez.
ma'am.
It's not a gown, it's a salwar kameez. See, this is where the students argue with us. Because he understand. Huh?
So it will add icing on the cake. So overall, madam, your appearance is very good. But if possible, please do all these 2, 3 changes so it will be more better. And so if you are
Ma'am
online
want to be
and
relaxed during online class.
no, I am just I am just
Wearing
giving an
sari is
example of giving a
tiresome, ma'am.
feedback. No, I am just giving an example of giving feedback. So still we want to add that though it is online, if you are in any interview or anywhere, you should not be eating in between the interview. So you have to tell everything. So it is total description. It is not what I like or what you like. It is overall that what general public will feel. Okay. Now, for example, somebody out of you all, I can say 1, 2, 3, 4, 5, 6 females. You all will feel that we should have a t-shirt and jeans in online. Okay. But you have to see that if you are at specific places, so what will look good? And that's why it covers the thing. It should be descriptive and non-judgmental. And as I said specifically, that the cloth need to be bindi. So I have taken 2, 3 points. Okay. So same way you have to, when you giving the feedback to the student, you have to be specific. You have treated patient very well. What well? He may consider that whatever he has thought good is good. So you need to give a detailed feedback. Okay. So what history you have taken is good, or what treatment you have given is a good. So like that it is required. I would like to share my slide. I would or मैं आपको there are 4 methods or 4 events for a feedback. This you can consider like this, that one feedback you can give just in time on the spot. बीबी ने चाय बना के दिया और ऑन द स्पॉट हम बोले कि कैसी चाहिए, चीनी कम है, ठीक है, जस्ट इन टाइम. Patient is student is treating the patient and you on the spot you are telling them that this is the way you should not treat or this is the way you should treat. So that is known as just in time feedback. क्योंकि अगर आप वो फीडबैक ऑन द स्पॉट नहीं दोगे तो चांसेस है कि चीज खत्म होने वाली है और बिगड़ने वाली है. So this is an event which is known as just in time. Now second is as soon as possible. Now sometimes it happens that your colleague is there, or though your colleague but just senior to you in the position is there with you, and you want to give the feedback and you know that if in between I will give, or you are organizing one conference and you know that the so and so chief guest is going to be hurted if your anchor has done such mistake. So what you will do, you can't go and stop him on the spot. So you will inform him or her as soon as possible, or you can give the feedback, please say sorry, or please don't do this. So that event is known as soon as possible. Okay. Third is within 24 hours or sometime soon. Or fourth is counseling feedback. You know that once your summative assessment is over, or sorry, formative assessment is over, you can schedule that roll number 1 to 10 on Monday, 11 to 20, Wednesday, like that. So that is also a feedback, but event is known as counseling feedback because you have scheduled that feedback event. Okay. So these are the 4 different event classification of giving the feedback. Okay. I will stop sharing.
Yeah.
So any comment, any questions or any sharing from your side?
I want each one of you one feedback on the session. Arun, start.
Ma'am, the presentation was crisp, energetic, and it is more informative, ma'am.
Very general.
But I wanted to know, are talking about giving feedback, how about taking feedback?
Yeah. So giving feedback is more easy than taking feedback. Taking feedback, you have to be understanding that is for your improvement. If tomorrow, if because of very busy schedule, if Mirna is unable to give the project on time and say, Mirna, this is the last day and you are not able to give, then I will be upset. So Mirna should take it positively. So you have to see it, but it's not necessary I should speak like that. One. But to understand the feedback, one has to be first and foremost inside having the strength to understand that it is for my good. Or if it is not for my good, I should be able to remove it and throw it away. Every feedback is not necessary. A teacher may say that something comment which is personal. You should not take it. So that even same thing with the faculty. See, what happens is if you're unable to take the feedback, Chinmay, can you comment of taking feedback, receiving feedback, the art of receiving?
Yes. Once everybody finishes, I will take that part.
Okay, then Narendra, comment about the session.
One specific feedback is that today there is a lot of disturbance in audio.
Okay. But that's not a feedback.
Okay.
That is the situation, environment, what you're saying.
Okay.
Somebody's video
See,
is not
today
muted.
everyone must learn how to give feedback. This will help you when you are giving a feedback to your spouse.
That feedback also is sir, we always suppress. Keep diplomatic.
That's why I'm telling that use sandwich approach. पहले उसको बहुत अच्छा बनाया है, बहुत ये है, बहुत ये रोटी भी अच्छी है, भात भी अच्छे है, दाल में थोड़ा अगर नमक होता तो अच्छा होता.
तो मीना बोलेगी खाना है तो खाने तो निकल.
So that is the threatening environment. So people will not give the feedback. So that also comes in the professional life also. If somebody is giving you feedback, if I give, मैडम आप कैसे लग रहे हो, और मैं क्या बोला तू, तो second time छोड़ो, feedback नहीं देना है. So if you want to take a feedback or get a feedback, you should have a non-threatening environment. People should come to you, approach to you. See, sometimes we are feeling that we are egoless. I accept everything. But in reality, in back of mind, we always have some type of ego. And that's why I think Padiyar sir can very well say that though we are open, we sometimes openly say that I am so much open, I am agree for the feedback, but then also few of the time we feel angry. अरे यार क्या feedback दे रहा है, यहाँ आ जाए तो पता चलेगा, ये मेरी कुर्सी पे आके बैठेगा तो पता चलेगा.
Yes.
ठीक है ना सर. तो though we are so open because it is our human nature, it is I can say physiology. So
Sir, feedback are always given better when it is anonymous.
yeah. Actually, we in Indian, yes, Meenakshi.
Sir, ma'am, today it was very crisp and on the point, but maybe a small video plays could have also been incorporated to display the different types of feedback. Because you were giving your own examples, maybe through videos, some plays, maybe that would have added more flavor to the presentations. And one important point I would like to add is feedbacks are usually normally what we have heard is all criticisms, ma'am. So can we think of feed forward, give them ideas how to improvise also on it, and then next time we can analyze whether they have improved or not.
Most of the models what I showed you is feed forward only. Okay. And actually we were going to have a role play, me and Gaurang.
Oh, okay.
And that Gaurang could not come, so I stopped that. But your point is well taken.
Yes, ma'am.
Last moment, a person may be absent. Video will not cheat you.
Yes, ma'am. Maybe it could be forwarded or maybe something.
Yes, very well taken. Very well taken.
Thank you.
In fact, today I wanted to have 2 breakout room activities. That Samik told me, Madam, आज ये breakout room नहीं करना. I said okay. I wanted you to break into 2 and discuss about when you receive the feedback when you felt very bad. And there are times when it really helped you.
Madam, in the teaching learning, if the students are made to feel that it is for their better learning that feedback is given.
You're
I think
good for
they'll be very
nothing.
Pardon, ma'am?
Your students are made to feel you're good for nothing, you mean?
No. It is for their better learning that feedback is given.
Yeah. That's why feedback comes in the teaching learning module. We take
Other feedback like faculty and all these things, the ego issues will come. But when it comes to students, I think if
No, that
it is
also is done in a different way. I don't take a lecture like this because I don't require knowledge for them. What I require is 2 or 3 or 4 breakout rooms wherein we give tasks, they discuss and they come out. So they say, yes, the first thing is I wanted it immediately. See, when you're young in the career and somebody would have told you that this is the way you can go ahead with your publications, you can improvise yourself with certain degrees or certain learning, and you can apply here for your fellowship courses in teaching, so it would have helped you. But many people, they have never got this help, they don't return it back because they have ourselves where we received feedback from our teachers constructively. It was
Very true.
always pass or fail. So that culture we have to now break. And we have to start giving from tomorrow in your colleges. Start small. Whichever students are allotted to you and the clinic, give them a constructive feedback. Use only sandwich technique for a week. Then use Pendleton technique. And I said, see, feedback should be immediate, constructive, and feedback should tell you what to do for the future. The new learning. Ask, you tell, again you ask. How will you go forward? We'll talk about feed forward more later. It's all about, actually, that's a little comes in reflection because you think of the past to go future.
Yes, ma'am.
That is the next session. Going back to go ahead is reflection. Now you want to add anybody? No? Yes?
I'm in my PG that after the seminars, the PGs, once they finish the seminars, they give one form for us to evaluate. And it has got a lot of like, how did they present? Was the presentations clear? Explanations, like the lot of questions. So it's already accepted format and they are giving it to us and they are asking us to evaluate that. So how effective is that, sir, madam? It is like, it's just a written format and we are giving. So is it a good way of taking feedback or giving feedback?
It's a very good way, and mostly if you don't write your name, it is still better. But even if you're writing your name and giving constructive feedback, see, a PhD work being, initially round of presentations, even the students who are not professional in that particular, I'm not talking of dental, I'm talking of in general, even they attend. You are allowed to attend a PhD presentation, first presentation, second, third, they have many presentations before they final present. So they are asked, many people who are junior to them are also there in the same subject. Senior to them, the teachers, it's a big way of presenting. Actually speaking, the daily things of life is sugar, salt is something different. Because I have very little sugar now, whereas somebody would like 2 spoons of sugar in a tea. But if you give me 2 spoons of sugar, I feel too sugary. You understand? So taste is very subjective. So let us go.
Lots of info is there.
It's again echoing Chinmay. Anybody else wants to add? Anand Kumar, Jyoti?
The feedback for this class is, it's really great, but like I feel the feedback has to be done by certain class of people who are going to give the feedback. For example, if we are if we have done a treatment to some patient, they'll give, the patients will give the feedback for the clinician. The same way, I think the classification of feedback and who are going to give for particular section, like it should have been more broad sense of class, I feel.
You
I
meant
don't
to
know.
say stakeholders feedback.
Yeah, right.
This
See, for
session is
example,
basically only to
yeah.
make you aware that feedback is constructive and there are different models. Whom you take the feedback, who is the stakeholder, is not the session. Because the stakeholders like patients, the community, the administrators, the teachers, the patients, the class 4 employees, nurses, everybody has to give feedback 360 degrees, even for a student. It all is the different ways you take a feedback for improvisation. But they will all use the model wherein they will know that they have to describe the task, and the student did not use a sterilized instrument. On the contrary, something dropped, the instrument dropped, and he used the same thing. The nurse who is looking at it, she gives a feedback. He's not followed the protocol. She may not be specific, she'll write. So it all depends on what you do. So see, now listen, I have told you to give feedback. Now because of that, you are thinking, what can be told more? What can madam could have done more? Instead of that, first say what is done. And you said the session is great.
It is
That
excellent.
is
The
because
feedback was excellent.
that great has no meaning. Because you did not attend, you said it's great.
Yeah, good.
That's okay.
Yes, ma'am.
That happens sometimes. That happens that when you have multitasking, like going to the college, doing this session and all, you can always catch up. Chinmay, all these things should be put up in the LMS or given to them, Ray. उनका फिर वो हाँ even the okay.
Yes, ma'am.
Okay. Anybody wanted
So
to
now,
say something?
yeah, I think Dr. Silpa was raising her head.
Hello. Yes, ma'am. Uh, Ma'am, I would like to share one, like how my HOD used to give a feedback when I was in PG, Dr. Ramesh Nagda, sir. So in front of the patient, he used to be give all the positive feedback. He'll be saying, "Oh, very nice processes, very good smile," all the positive things, so that the even patient used to feel that yes, my doctor has done very good job. And after that, when he used to go for washing his hands, that time he used to give what all the corrections has to be done, not in front of the patient, but little away from the patient.
Very good.
So
Very
that
excellent.
it was very good way of giving a positive and a negative feedback, so that even the patient is very happy, even we also felt very happy. Sometimes what happens when the teachers scold in front of the patient, that is quite insulting. So my HOD sir, he did a very good job. Like, I appreciate that method of feedback.
So anybody else wants to talk, or you give me a quantitative feedback on a scale of 10? See, I'm telling you different ways of taking a feedback.
8.
Huh?
8, ma'am.
Okay. So now the answer comes to me that 2, how to improvise. Did you get the point? That 2, what can I do more? See, this is at this level that I'm able to take whatever you say. Imagine at 18, 19, 20-year-old. He will not. So, okay, on a scale of, you gave me, you said 8. So now like a Uber driver, I want 10 out of 10. He tells me, madam, please मुझे 5 ही देना, 4 नहीं देना. I also want 10. So what can I do more?
So, ma'am, we have given you option for improvement for next time.
Okay, doesn't matter.
But how she will come to know? So whenever we are asking any feedback form, at the end we have something to write how to improve. So for 2, sir has said 8. Now there is something which is missing. For that you have done -2. So what is that thing? That you should be clear. Otherwise in our mind बच्चे को 100% मार्क्स तो कभी देने के ही नहीं. You will never give 10 out of 10 because ये अपना टीचर का mindset ही है 10 out of 10. How is it possible? But you should be very clear in giving a feedback that why you have given 8 or 7 or 6. So what are the things you were
Sir, it
thinking?
is actually it is difficult to hold on the attention span for a lengthy period of
For
1
that, the
hour.
feedback to you should be less, not to me.
No, so you have
Remember
to
the
make it
student.
little bit more interesting, so that every time you dodge off, you will just wake up and see oh something some interesting slide is coming up. So more
See,
animation
let me give.
maybe, and little bit interaction was there, ma'am. But I think it need to be little bit colorful and little bit more picture.
That is her perception.
My perception.
Yeah. Anybody else? She said put more animation. See, these topics last year we did lot of videos and animation. Used to take 2 hours one topic. We ended up taking 70, 80 sessions. So what happens is lot of time of viewers for 2.5, 3 hours. So if I want to give feedback completing in an hour, see, time restraint and definitely well taken, little bit of animation or story. See,
No, ma'am, it was crisp, but to hold on the attention, it needs to be in between needs to be put one
like
of
a breakout room.
Yeah.
Okay. And Meenakshi said video. So that comes to 1 mark. One more mark. When will you give me 10?
वो तो
Madam, like
मेहनत करनी
Chinmay sir said, is there an inherent hesitation for anyone to give 10 out of 10? Because sometimes I feel
That's also that. Very true. See, many lectures I attended abroad also, and you were told to last to give a feedback. Automatically, I gave 8. I never went above. So this is a human psychology.
Okay. So
Yesterday I was.
so let me come to the point how to receive a feedback. It was receiving a feedback. It is again I think echoing.
Ma'am,
Sir,
please
voice
don't be
is
sad for that 2 points. Took a very good effort.
No. See,
Are you able to hear me now properly?
Yes, sir.
Yeah. Okay. So let me share the screen again. So what is this? Madam, you are muted.
if I take the feedback positively, probably I would many folds improve in the what the participants want. You agree? That is why the feedback for every lecture. Because
Sir, is this hierarchy of needs Maslow?
yes.
Now you see the top of this is self-actualization. So when it comes to receiving of the feedback, it is actually a self-actualization. Okay, what am I? When people is giving you a feedback, it is giving you what you are. So it comes highest level पे. And why it hurts us when somebody criticizes? Because he is directly targeting your highest need of an hierarchy. ये basically when you have reached up to this level and the person is targeting, and so we have to be careful when we want to take any feedback. Okay, so there are few things we have to keep in mind. Number 1, appreciate the compliments. Whatever is compliment given to you, appreciate it. Okay, whatever positive feedback is given, appreciate it. Clear? For example, okay, you are looking nice, your face is good, or your shirt is good. Okay, and feel good about it. Okay, मेरा इतना तो positive बोला. So yesterday I was watching one that Kapil Sharma show. So in that fellow was telling that Alka Yagnik has told me that you are very mature and you are very understandable. Don't keep messaging me unnecessarily. So other person said that इसमें आपके लिए क्या अच्छा फीडबैक है? So she said that I am mature and understanding and that's why I should not give the message frequently. So whatever is given positively, take note of it and try to take it as good as possible and give to your what I can say your hypothalamus. Don't explain why negative feedback. Okay. For example, if you say that, sir, you are not looking good without specs. Okay. I have to keep in mind that, okay, I am not looking good without specs. And if you will continuously arguing for whatever negative feedback is given, the other person will think that you are not ready to listen the negative feedback. So then he will stop, like we do with our wife. Okay, you are always looking good. Clear? So don't explain why negative feedback. Third is don't overreact. Sometimes it's our physiology or it's our human nature that we will start reacting. Specifically, when we have done something and opposite person is not able to appreciate it. Okay, so at that time try to control the emotion because he also knowing that you have done thing. So don't try to overreact. Let him finish. Sometimes what happens then we go to the dean office and dean sir said that okay Chinmay, you have done this, but you have not done this. So immediately it comes to our mind that इतने सालों से इतना काम कर रहा हूं लेकिन इतना भी सर ने कंसिडर नहीं किया. But look at it why he said this. Okay, so don't overreact it. Sometimes what happens that if you are try to overreact, it may hurt you more. Okay, and make your own decision about validity. एक हिंदी में कहावत है सबसे बड़ा रोग क्या है? नेक्स्ट सबसे बड़ा रोग
पता नहीं सर.
क्या कहेंगे लोग? है ना, सबसे बड़ा रोग क्या कहेंगे लोग. सो मेक योर ओन डिसीजन अबाउट वैलिडिटी. अभी जिसको कुछ पता ही नहीं है कि भाई ये क्या है, पीपीटी क्या है, वो बोलेगा ये तूने रेड क्यों किया है, ब्लैक क्यों किया है, तेरे को कुछ पता नहीं चला. भी उसको पता ही नहीं चल रहा है तो वो क्या मेरे पे फीडबैक देगा. लेकिन उसने फीडबैक दिया है तो सुनने का, साइड में रखने का. सो हाउ वैलिड अ फीडबैक ऑफ ऑपोजिट पार्टी इट दैट यू हैव टू डिसाइड कि वो जितना बोलता है उसमें से मुझे कितना लेना है. ठीक है, क्लियर? People's opinion are only their perceptions. Are you getting? Last 2 point is set specific smart improvement goals. Okay, for example, today I am asking you, as madam has asked you, that please give feedback on my session. But you should have a clear goal that today I am focusing on my PPT skill, or today I want to focus feedback on my speaking skill. So have your own goal when you are taking feedback from others. Okay, so you will be able to address it properly. And lastly, if you think that you want to improve yourself, go to that person again. So now madam is going to ask Pariyar sir again after 2-3 sessions that how was the session. Are you getting? Today she scored 8 mark. So again she will come to you after 3-2 sessions here. Oh, was it okay or not? Am I 10 out of 10 because she want to improve. Okay, so follow up to the same person for the progress. So if you keep this 6 servant with you and taking up feedback, it will be excellent. Now have you heard about this?
I showed this in the presentation in the conference.
Okay,
but they were not there. They were not there.
Okay, so growth mindset and fixed mindset. So whenever if you are ready and positive with all over 6 points I said, you are going to in the growth mindset because you want to grow again. But if you don't follow the feedback and don't do anything, you will be falling in the fixed mindset category. And lastly, in the last slide, let me summarize.
The fixed mindset is where you say they're always criticizing me, and I am overworking, and still the dean is giving me more work. Just because I'm working, he's calling me. So this is all fixed, but this is an opportunity for me. And the critical analysis to me is to only improve me. I can still do better. Growth mindset.
Okay. And lastly, summary of the first part, that is feedback. So feedback is important because it keeps. So this is regarding actually a team feedback. It can keep the team going. Okay, you have a team of 6 people, 5 people, you are a department head, you are dean. So it keeps the team going. It gives the feeling of belonging or purpose. कई बार कई लोगों का होता है, ओह मैडम ने तुझे अप्रिशिएट किया, मतलब जबरदस्त, वो कभी किसी को अप्रिशिएट कर ही नहीं सकते. ठीक है, तो it gives a feeling of belonging and purpose. It increases the growth and happiness. See, most of the people work with you only to get some feedback. Salary तो उसको ऐसे ही मिलने वाली है. दो अच्छे फीडबैक दे दिया आपने तो he will be definitely happy. It unlocks change and innovation. It prevents team from being stuck and discouraged. And as we know, a sandwich feedback, this is on the side, but let me increase the grill, make the sandwich to grill sandwich. Okay, तो बहुत सारा हमने उसमें कंटेंट डाल दिया है सैंडविच में. नाउ begin with the positive comments regarding the situation in the question. Give praise for the person's strong point. Give compliments. Give the criticism. Remind the person of again strong point and give thanks. Offer support in the area for important and leave on the positive note. Okay, so I think here we are coming to the end of the first part, that is a feedback. Any questions?
Chinmay,
Yes,
what I
ma'am.
was telling, can we break them into two groups? One will do a Nalova model, Pendleton model. Other will do the sandwich so they understand the method better and they'll present it.
Sure.
Let the feedback
समीक, हाँ समीक बे ग्रुप पाड़ने बगा.
समीक छे की नहीं?
छे.
ई ना पाड़ी मने आज. ईचे आजे तमे नहीं करता.
ना उभा रहूं मैंने कही. ये छे.
It's okay. I think there is some.
Now I am co-host, so I think I will be able to do it. No problem. 1 second.
See, I want you to group one.
So rather, madam, 1 minute. So let's do one thing. You all of you take a 2 minutes, and now decide. As madam has shown you 2 model. So roll number 1 to 5 will work on Pendleton model, and roll number 6 to 10 will work on which model?
Sandwich.
दूसरा कौन सा? Sandwich. Yeah. So now I am giving you the situation. So for
Kindly show that Pendleton model slide one more time, please.
Yeah. Okay.
So till then I will give you a situation. For roll number 1 to 5 where you have Pendleton models. So you are looking at your undergraduate student who is a third part or he is in a final year, and you have asked him to take an impression of an elderly 70-year-old male, and he talked nicely, he has done everything nicely, but when you look at the impression, it is not proper. Are you getting? I am repeating again. So you are giving a feedback to a student which is in the final year of undergraduate. You have asked him to take an impression of a 70-year-old male. What he did, talked nicely, communication nicely, but the impression was not proper. So now use your theory to give the feedback. And now for roll number 6 to 10, slide show. And for roll number 6 to 10, you have your boss and you are in the MEU meeting, and he has just completed his session as asking you a feedback regarding how his session went. So for roll number 5, 6, 7, 8, 9, 10, this is the case. So take 2 minutes, think what you want to do, and then we will have a presentation from you.
I'll first show the
Can you-
presentation model.
Yes, please.
Yeah. So check whether the learners are ready to take the feedback. So just inform them that the feedback is for your improvement. Shall I give you a feedback? Let the learner give comment on what they have done, the impression or the writing or whatever. Learners state what was done well. They comment on what was done well. Now, as a mentor, you state what is done well. Learner states what can be improved. The observer states how it could be improved. He said what could be improved. I could have captured the distolingual region better. So you say you extend the tray, support with your finger, or whatever you want to say. Ask the patient to take out the tongue, not fully out. Just make the movements only inside the mouth. And then an action plan. Now tell me, how will you improve? Did you get it,
Mirna.
Mirna?
Yes, ma'am. Yes.
Yeah. See, like this, when you are not paying attention, your students also don't pay attention sometimes and they miss on it. And are you ready to take a feedback every day from tomorrow from your students? In India, we are not ready. I have tried to introduce this, but the faculty really object. This because some of them have not prepared, or some of them just have issues with uh, using new slides and new way of talking. They're using year after year same, or maybe they are not confident of the material what they have, so they are not ready. Everywhere abroad, the student feedback gives you the job for the next year. No one is permanent everywhere. So now think for yourself how easy it is to give feedback. You easily gave me so many things, but it's all taken. I told you.
Because you
Appreciate
took it
it.
in a sportive way, ma'am.
Yes, ma'am. Yes, madam. That is important because I am a learner throughout my life. I still want to do good. I compete with my children. I tell them. They tell me you're a little dyslexic with all these tools and apps and all. But when I tell them a few things, they say, Mom, you're smart, huh? You're smart. But I am not as good as them because they're born with it. And let not the age factor come in your mind. Let there be always that you are a final year student of 22. You can grow up to be a young 30-year-old, not beyond that. I have refused to grow beyond 30. I have always tell. Because mentally, close your eyes, how do you feel is what matters. Okay? So now pay attention. So how will you draw? You told me animation. So you draw your students' attention with animation next time, or maybe using a app. See, if I knew this session was for 2 hours now, nothing of this sort I would have done. I would have made you come out with answers, asking you questions. But I wanted to finish reflection because last year we could not finish reflection. We took it very short because of this one session going so long. And according to me, reflection is a very important session. So you are giving a feedback. The learner is made mentally ready. So now, Mirna,
Yes,
can
ma'am.
I give you constructive or can I give you my thoughts on your lecture or your session? So you are already made ready, and I would give it so that you may like to take it to you may like to take it to improvise. You have to take nahi bola.
Okay.
So the you as a teacher will say, today I took a session for the final year students on the impression materials and how which is used in which areas and all, which situations, like maybe a complete denture, fixed partial denture, implant, various materials I have taken. I think I could have added this, or you will say that the session really went well because I had a lot of videos for showing the manipulation and using different techniques. So if I have been observing you, I will say that yes, you have done this well, very well. In fact, that particular animation was good, and this information was valid. Otherwise, what will happen is, animation may, in education we discourage too many animations because that's not scientific. That's not very scientific. Abroad, if you go, they have 20-minute presentation which gives me a load of information because they have given, but I have to be attentive. And it's not very difficult, neither it is too easy to pay attention. It's both. If I'm sitting and thinking here because my emotional level is low, I fought with my husband and you should have told him this or something like that, I will not pay attention. But when I come and say that all is well, everything will go smoothly, take it as it comes, I will pay attention. Teacher is a human being. Morning, when he has not had a good day with the principal and he comes to the class, he is not going to be great with the students. So you give a feedback. Then observers now state what was done well. Then the learner state what could be better. The learner, in this case, you are the learner, Mirna. You could say that as in the session, I could have done this better. So I can add how to do it. I think there are some materials which you have not mentioned. So I'll send you the article. You can include it from there. Or I'll send you some pictures. And now both of us can decide how this session can be made more palatable to the students. Is this clear now?
Yes, ma'am.
Yeah. So there are certain rules. It is very important self-assessment technique to be taught to the students. Because if the students cannot self-analyze, have you observed many students telling, my exam was fantastic, I have done so well. And he has failed. And then he says, I was failed. Because you never taught him how to self-analyze. That is one thing. Then what was done well can be reinforced by the facilitator. You can tell the student, yes, I think the chair positioning this time was so ergonomic means the friendly with the environment and the operator. The ergonomics was good and I really appreciate. Or maybe that you have really analyzed the issues of the extraction done long ago of the left side lowers and then the extrusion of the upper, and that's why the upper ridge looks as if it is coming down. What do you call this syndrome? Something like that. And skills used to achieve successful outcome. What is the skills needed? First is the self-assessment. You tell him and reinforce his self-confidence. And then the skill can be learnt better, that you tell him. And assessment by learners, what could have been even better. What could have been, self-assessment is so important that you will realize the importance when you start self-analyzing yourself. See, there are times, I read the other day, that a person lost his luggage in airport and he himself is elderly and a person with difference. He went to the lost and found and told the lady there, I know you have a magic wand, and with that magic wand, please find my luggage. You can do it. That lady, he says, went to the carousel herself, found out she didn't get, she went out from the room and she brought. And when he waited to thank her, she was not seen. So she started walking towards the gate. She came running and asked him, did I have a magic wand? And she said, thank you for that. If you would have gone, he says, and said that the airlines are so bad, you people lose my luggage, and what is this? My time is wasted. She would have said, come tomorrow. Feedback given to the students, if it is palatable, they will take it. Feedback given to a faculty, palatable, they will take it. If I say that, Meenakshi, that lecture was not good and I didn't understand anything, and if the students are not able to focus, there are many techniques of interaction we can use in a large classroom. Confusion technique. We talked about confusion technique. You can use whatever you want. Think, pair, and share. You think for half a minute, share for half a minute, and then you share your thoughts and share it to the audience. Self assessment by learners is important. And then the facilitator suggests alternative skills if required. So anything is the same model. Self-assessment, reinforcing his belief in himself, drawing together a plan how to get better together, and even suggesting how to get there. Learner feedback to facilitator, content of feedback and skills. See, learner gives the feedback. Yeah, I like the way you gave me this, and so I could improvise. If you don't give the feedback constructively, he has the right to tell how to do it. See, with this, you are in this group, so you will accept it from henceforward. People don't accept. Ask the deans. If one sentence told to the junior lecturer also, he feels that he has been insulted, and they don't take it. They have vindictive feeling many a times. It is a self actualization. Directly को hurt करता है हम. You are hurting my ego. I feel I am something, but you are saying I am nothing. So this also model can be used. What you saw, just describe what else can be done, and what the learner thinks about it. Can we set a goal? So again, describe descriptive way what the task is, how the task can be done in different way, or what more can be done, what the learner thinks about it, how can he go ahead. That's all you are at. So I think I'll stop sharing and let's divide in the two groups. Acha, he told you to 2 minutes think, right? What did you
Madam, what I'm thinking that once they will share their work, we will keep reflection for the next time.
Yeah, reflection is almost 10
Yeah,
to
because it is almost 7:46. That's why. Okay, so take your time, and then all of you will present, and other will give the feedback on feedback.
Ma'am, can I start?
Yes.
So, if a student come with a final year student come with a impression in a kidney tray, so I would like to tell that I would like to give a suggestion to you. You may accept. I can't say
So you
may
cannot say
accept.
you may accept.
No, because he has to accept.
Let's now
Okay.
together analyze the impression you have taken
Okay.
For for your betterment or whatever you can say.
I am giving you some suggestion for your betterment. And
Madam,
what you
I think once let the participants finish everything, and then we all will give the feedback, and we will give the last.
okay. Sir, but what I think that it will after I finish it, if you'll give the feedback, then it will improve my thing. Okay, so I would say I'd like to say the student that I would give you some suggestion for your whatever you impression you have made, and do you think first you tell me what you have done, what you think what you have done right in this impression. After the student will make that whatever landmarks I have obtained in this impression, then I will say that you could have got this landmark also. Then I'll ask the student that do you find any defect in this impression or lacuna in this impression? The student might say that this particular area is missing or there might be a void in this area. So I'd like to tell the student that either you have to take a proper do the proper tray selection or modify the tray so that better impression would come. So in the end, I would like to ask the student how to modify the tray or how much amount of material the student might take or how to adjust the chair position so that impression will be taken properly. And any of my colleague in my group, if they would like to add something to it.
Madam, I just share a screenshot. I just typed it. You just have a look into it.
Okay.
Okay, any feedback from other participants? सब
Sir,
लोग
in the
सोच रहे
task
हैं
that
recap. हाँ.
task you had told that did communication well. That aspect, the feedback on his good communication to the elderly person also can be included.
Hello.
Yes, yes. So this is, you are sharing on your behalf or you are giving a comments to Dr. Mirna?
Ma'am, your voice is not coming. You are muted.
Yeah, so I was asking Dr. Siddharth that whatever he has projected is feedback to you, or he was sharing his own view.
Sir, it's my own views.
Okay.
Can
So
you
that
anybody
you have
give
shared
a feedback
as-
to Mirna? Each one has to compulsorily give one feedback. Start, Meenakshi.
Can I, madam?
Yes, sir. Yes, sir. Please, sir.
Dr. Mirna has made an excellent attempt to follow the Pendleton's rule, which was just explained by madam. And the way she has explained it reinforces whatever we learned today about Pendleton's rules to be followed, Pendleton's method. So it was a good effort, and again I would say it reinforces whatever we have learned today.
What could be done better?
One, like I said, one aspect she has not included, that is the student could communicate really well to their elderly person, and that aspect could have been reinforced.
Or he might not have been able to communicate, whatever.
Okay.
And what about getting the student ready for the feedback? That part can be improvised. She told the student that I told her to say, let us, in the meanwhile, Chinmay said, please wait. Because I was telling her, let us analyze the impression. Let us see how well you have taken. But what did she say? She said he brought in a kidney tray, and I said, are you ready or something like that? I don't remember. What did you say?
Yeah, I'd like to give you some advice regarding your improvement. Are you
Cannot
ready
say
to take it?
to a final year student or a PG student, I would like to give. You have to give. The language changes a feedback from student to a faculty to whom you are giving the feedback. Let's see how well you have made the impression. Let us see. You're authoritative, at the same time polite.
Yes, ma'am.
And you are saying, let's together see. You're getting him ready. Or let's see how you are taken the impression. Let's analyze it. So he knows it. You are analyzing. There was a time when we were students, one teacher used to say, your midline is slightly on the left. We used to do nothing and take it. I said, now it's right. See, you corrected. Do we want to become like that? He was famous for that. And we have told the juniors, don't do anything. When he says it's on the slightly on the left or midline is not coinciding, you just do something, and say, yes, sir, thank you. The students know about the teachers and the weaknesses of teacher as we know about their weaknesses. In this whole analysis, did you realize that taking a feedback is not easy, giving a feedback is not easy? If I
So
would
we have
tell
to
you,
we have to avoid being stereotypes in our responses. That is what you meant, ma'am.
yes, you have to be seeing who is the audience, who is the person whom you are giving feedback. Right? It is not in a professional way. If you're giving a feedback to a postgraduate as a feedback, weekly feedback, everyone gives a weekly feedback on the whole thing. And he gives it right, how to improve, where to improve, and when and what he should learn, which courses he should do more to improve in that area, and why his educational research, or sorry, the clinical research is going in a very slow pace. How can it be made? So they give constructive feedback. There you can say, oh, so you're back. We are back for your analysis. Have a seat. And let me tell you that these are the areas I find that you're good. These are the areas I find language, your body language speaks more than your speech. I can say, you are an idiot. It will not be taken so easily. You are good, but you will take it seriously. Kaisa bola, kaisa muh kari madam ne. Did you understand what I'm saying?
Yes.
Body language is more important than the what you say. Do you say to a person, I love you? No meaning at all. I really miss you. And the moments you are not there, I really miss you. That's a different one. So how you tell, see all these things, today we have taken the feedback session too long. It should not have been. I wanted, see, in education we say, make it short and make the learners think about it. Your experience has to be added. मैंने आपको फीडबैक पूछा तो आपने दूसरा डायरेक्शन, फिर तीसरा डायरेक्शन, फिर ऐसा करके 8 बज गया अभी. Now the feedback is, I told you initially, you're feeding certain knowledge. You want to know how much they learn. Feedback. You want to know that. Like a teacher, the word contains to each. To each is a teacher. That means the teacher knows the learning capacity and how much more or less should be given to a person. You're all faculty. So I feel that it should be done for 1 hour and you should think over it and we can digest more, assimilate more. And paying attention, you should have your own tricks also. I can have my tricks of calling you by name in between, or by asking you to answer, asking you to read, or you said animation and video. Video can be shown one. If you go to educational conferences abroad, they have black and white slides many a times. Those who have witnessed know. And the 20-minute presentation, amount of wealth is lot. But we need not make it as a routine just because we want to do that. The advices are well taken. In fact, I am going to do that for reflection now. Reflection I made in a very different way, but lot of information was there because sometimes people don't give you that kind of information. I made it a different way. Now I am going to give palatable to you what you want. I'll reduce the information and give you animations.
No, ma'am.
No. Reduce the information means not take it out, but give it to you in a different way. That's all.
Yes.
Information at the end will be same. I told you how you comment is taken. That is how the opposite. What did he say? You have a magic wand and you will find my luggage. In 20 minutes, he was out of airport. Otherwise, what they say, come tomorrow. This is the tag, come tomorrow. आपके मुंह में शब्द है. If you tell the faculty, I really depend on you and you can do it, he will do it for you. You have increased his self-esteem and self-actualization. By the way, yesterday we had a CCHPE people presenting and they got the best paper award. Both Shabina and Prithika on structured viva. She took one of them. And there were a lot of other people also who had presented on this. People started understanding a little language of education now. So they were asking a lot of questions to her regarding what do you mean by structured viva? This we will do when we do the other these things, assessment and other things and all. So what is a regular viva? What do you mean by viva cards? What are domains? And how you can slowly mark it out, mark system. See, that whole thing is a different ball game. We'll talk about it. But I'm happy that we have done this extensively so that you know that this feedback is important and feedback receiving is more important. Tomorrow, if your dean says that Gopal Krishnan, I think you have not done this, don't take it negatively. Take it that he wants you to do more. And how can anybody invade our mind? But all the time, our mind is invaded by our exterior. That mujhe aisa bol diya, they have told this to me, and now you cannot become self-worth. I leave you with a note of self-worth. People go into depression only because they find that they are less worthy now. Do you know your worth? Do you know the worth of you? Not in terms of money, not in terms of your contribution to the whatever you are doing in your profession or family or anything. You are having so much power that you, human being, go to the moon, or you have a magic wand to create these bullet trains and other things, other infrastructures and dams and other things. So the hidden energy in me, which is actually me, cannot be, worth cannot be exaggerated because it is invaluable. That's all I can say. So what is your self-worth? Not because I'm useful. Now my children are on their own and they don't want me anymore. They want you, but they have moved on to their life. Isn't it? So my self-worth is what I think about myself. Feedback is how you take it, thinking your self-worth. Yes, somebody told me this, but I will analyze and look into it. I cannot change my looks because somebody said that today, madam, you are not looking so good. I can think that maybe I was tired or maybe I was thin, but I think my internal beauty always reflects on my external beauty. So I am beautiful. That confidence itself is enough to propagate. So can we all have good dinner? Yeah.
Yes.
Yes, ma'am.
Good night, ma'am.
Now, just for the sake of it, how much do you give me now out of 10?
11,
I'll
ma'am.
give you 10 out of 10, ma'am.
No, I
11.
want 11. I want 11. See
out
that
of 10,
thing
ma'am.
in my mind. See, this is what
By seeing
happens.
you that smiling face, na, that gives me smile in my face. In spite of the fact that I am in so much stress, I actually started smiling seeing you, ma'am.
Acha, okay. Your dad is good?
No, ma'am. I guess he was discharged, but again, because of this, that catheter is being given now. So again, he has this urinary tract infection and fever has increased. So we have started IV antibiotic.
Okay.
So now the temperature is down. Let's see.
Yeah, okay. Yeah. All right.
Okay, ma'am.
Arun, you did not open your mouth today, man. Is it
I
because
tried.
you are
I tried to do, ma'am, but there are so many participants who are.
No, but you have to see next is when you put a हाथ का sign udhar. So we'll
Okay.
call you.
Actually, ma'am, I spoke the maximum today.
No, I like it. I like it. You need to speak more, Mirna. You see, each one of you have some asset. You should share it with all of us. Life is a journey, and how to make that journey beautiful is in my hand. It's not a destination.
Yeah.
Yeah. Okay.
Okay, ma'am. Good night.
Yeah.
Thank you, ma'am.
Night.
Good night to all
Good
of
night.
you.
Feedback brought
Good
a
night.
lot of, I think, psychiatric factor also in the.
Okay.
Uh,
Okay. Good
Good
night
night.
to all of you. Yeah.
Good night.
Night.
Yeah, good night, ma'am.